for hair loss, there is a natural therapy. So restoring hair can be done, and I want to tell you about how we use PRP and PRF here at San Diego Integrative Medicine and Spa. Hi, I'm Dr. Cutler. And this comes up often here in this medical spa because hair loss is not easy to restore. Some of you have had COVID infection. I'm one. I lost a bunch of hair through that. And others have gone through pregnancies. But you know, this most common cause of hair loss is a gradual receding of the hairline in the forehead and the scalp and the sides here of the face. We call it androgenetic alopecia, right? So alopecia means hair loss. Androgenetic means there's a hormone base to it. Men know this because androgenec alopecia is the classic male pattern baldness, where the back crown of the head's losing hair and it's falling, it's coming back. I'm getting all of that. But you know what? There's ways to help thicken that hair. Let me tell you what it is. It's your own blood. Extract out the red blood cells and white blood cells. Now you have the platelet-rich plasma portion, the yellow liquid gold. It's full of proteins that stimulate the cells that are hair follicle cells in the pilo-sebaceous unit. It will stimulate those to regrow. And the ones that are quiet, that are sort of dying off, that are around the hair. So the best candidate would be someone with spotty hair, but at least some hair, and or just thinning hair, but lots of hair. And that injection is done through a tiny little needle after numbing cream is placed. I inject it in little centimeter spaced areas like a grid over that area and inject about 1/10 of a cc of this fluid, your blood, remember, and done a spin down. Now it's in a syringe and I inject it into there. And you walk out after an hour procedure and there's no downtime. Really. You may say, well, it sounds painful to be injected with a needle. Well, guess what? You know, I've tried it different ways. Some people say it's no big deal. It's a tiny needle. They don't even need anything. Just cleanse the hair with a little Hiba cleanse in the scalp area. Others need some topical, 23% lidocaine, 7% tetracaine, 10% benzocaine, the best compounded topical that I think any compound pharmacy can create. Took 2 years for us to get it. Or if it's still painful, some people are very sensitive to that. I have a NitroSeal, which is a nitrous oxide sedation analgesia system. It's nice to pull out. Just have a couple of puffs on that, get you feeling pretty floaty, happy, and then away I go with the procedure. Pain is easily tolerable. The downtime is zero. Now the effect. How long does it take to see that hair starting to grow in around there? It takes about 4 months. You're going to see some thickening of the hair, and then you'll say, well, what do I do? Is that it? Is it permanent? No, I want you to know it should be a second and probably a third treatment to do more and more to get that hair to grow. I've seen some before and after pictures of 6 treatments where man was pretty much 20% of the hair came back to about 90%. It does work. About 50% of the men get a really nice result, about 90% of women. That's just statistics for PRP and PRF. What's the difference between PRP, platelet-rich plasma, is your blood then spun down through a patented gel filter that pulls the red blood cells, white blood cells, lets them go through and holds the platelet-rich plasma portion. That's PRP. PRF, platelet-rich fibrin, is a vial of blood, same needle poke, by the way, and I get 2 of these, and I do a slow spin down to get that yellow fluid, which is rich in not only those proteins that are stimulating those mesenchymal stem cells that are there, meaning the cells that are growing in there. Which tissue should I become? It stimulates those to become hair, for example, because it's placed around the hair cells, but it also has stem cells in it, according to the scientific literature. So you have these stimulatory proteins plus stem cells in the PRF from your blood. So PRF is easy to obtain too. It's just 1 needle poke. I get those 3 vials, do the 2 different spin downs, and away I go to inject into your scalp. Now, this procedure can be done, like I say, in an hour, and it should be done repeated. I think that there's nothing better for hair regrowth short of the transplantation procedure, which I don't do, but certain doctors are trained in that, where they transplant the hair from one area to another. Much more expensive, much more difficult to do, but it has the risk of hair receding as well because we're genetically programmed. We have to always think of maintenance once we achieve our goal. So if you have questions, please leave them here. Subscribe to our channel. I'll be happy to teach you more about hair restoration using your blood, the most natural method on the planet.